everyone. In today's podcast, we're going to talk about the different types of midwives who attend home births in the United States. Hi everyone. So last week we talked about the rise of home birth in the United States and how home birth has now reached 1% of all births in the United States. And out-of-hospital birth has reached 1.5%. Today, we're going to talk about the different types of midwives who attend home births in the United States. If you're interested in the topic of home birth, we are having a free to the public webinar this week and next week. You can register for the free webinar at ebbirth.com/homebirthwebinar. Last week and this week, I'm going to be giving you some background information so that you can be prepped for the webinar. Today, we're going to focus on the types of training of midwives who attend home births in the United States. But when we get to the actual webinar, we're going to talk about the safety statistics on home birth in the United States, Canada, and the United Kingdom. So I'll talk a little bit more about the training of Canadian midwives and midwives in the United Kingdom in the webinar. Today, we're going to focus on the types of midwives who attend home births in the U.S. Most attendants, 78% of attendants at planned home births in the U.S. are midwives. Physicians attend only 0.9% of planned home births, totaling about 260 planned home births with physicians. U.S. birth certificates only collect information on two categories of midwives. You can either check a box saying that the birth was attended by a certified nurse midwife/certified midwife, or you can check a box that says a non-certified nurse midwife, non-certified midwife. The category of certified nurse midwives and certified midwives attend 28% of planned home births, and non-CNM/CM midwives attend 50%. It's important to realize that the non-CNM, non-CM midwife category, also known as the, quote, other midwife category, lumps together both traditional midwives and certified professional midwives, or CPMs. This means that we cannot use birth certificate data to look separately at midwives who have completed one track of education versus another track. So we can't compare CPMs to traditional midwives who are uncertified or unlicensed. And in the same way, we cannot use birth certificates to compare outcomes for certified nurse midwives and certified midwives. In fact, birth certificates in the United States have a lot of drawbacks when it comes to evaluating birth outcomes at out-of-hospital births, which we'll talk more about in the webinar. So how do the different types of midwives in the United States compare? Your ears may already be confused by all of the acronyms I've already thrown out there. You could almost call this next part of the podcast acronym soup. There was a great article published in the Journal of Midwifery in 2018. The lead author was somebody named Penny Marszalek from the Ohio State University, and the name of the article is called Midwifery Education in the U.S. Certified Nurse Midwife, Certified Midwife, and Certified Professional Midwife. This article is a peer-reviewed summary of these different types of credentials, and it was co-authored by an interprofessional team of all three of these types of midwives. Thankfully, this article came out just in time to help give me and my assistant some background info as we prepared the outline for this podcast. So let's talk about CNMs first. A certified nurse midwife, or CNM, has a nursing degree plus at least a master's degree in midwifery currently. There are some CNMs out there who did not earn a master's degree before that was required, and they were grandmothered into the current guidelines. But currently, if you want to become a certified nurse midwife, you must have a nursing degree plus a master's degree in midwifery. The American College of Nurse Midwives, or ACNM, is the professional association for CNMs. That's different from the certifying agency for CNMs, which is the American Midwifery Certification Board, or AMCB. AMCB is accredited by the National Commission for Certifying Agencies, or NCCA, which is the accrediting body of the Institute for Credentialing Excellence, or ICE. CNM educational programs are accredited by the Accreditation Commission for Midwifery Education, or ACME, which is authorized to exist by the U.S. Department of Education. To become a certified nurse midwife, you must first graduate from nursing school, and then there are at least 40 CNM educational programs in the U.S., including 2 that prepare CNMs and CMs together. Most of these programs are associated with a university, and most are housed in schools of nursing. A CNM scope of practice includes a wide range of health services for women and adolescents to menopause and beyond. So not only can CNMs attend childbirth and care for pregnant people, but CNMs also provide gynecologic and family planning care. So for example, for your first pelvic exam or pap smear, you might choose to go to a CNM instead of a physician. Someone who wants to be a CNM must complete an educational program that includes a wide range of clinical experiences which have been determined by ACME. These include 10 preconception care visits, 15 new antepartum visits, 70 return antepartum visits, 20 labor experiences, 20 births, 20 newborn assessments, 20 early postpartum visits, 15 postpartum visits, 10 breastfeeding support visits, 20 family planning visits, 40 GYN visits, and 40 primary care visits. After they complete their educational program, they must pass the AMCB board exam. CNMs can become licensed in all 50 states, plus the District of Columbia and U.S. territories, and they can attend births of babies in hospitals, birthing centers, and homes. Although there are a few exceptions to the out-of-hospital laws. For example, in Nebraska, CNMs are prohibited from attending births at home in the statute. However, the vast majority of births attended by CNMs take place in hospitals. CNMs are not required to have any training in out-of-hospital birth before graduation. And in most cases, CNM students do not do clinicals in homes or birthing centers. If a CNM graduates and wishes to practice in an out-of-hospital setting, typically they have to have additional mentorship and experience in that out-of-hospital setting before they feel comfortable practicing independently in freestanding birth centers and homes. CNMs have prescriptive authority or the legal right to prescribe certain medications in all U.S. jurisdictions. Their care is covered by most private insurances, and Medicaid coverage is mandated in all states. They're also covered by Medicare and TRICARE, the insurance agency for military families. CNMs must be recertified every 5 years. Next, let's talk about direct entry midwives or DEMs. Unlike the certified nurse midwife, a direct entry midwife enters the field of midwifery directly instead of first going through a nursing program. Historically, in the past, all midwives were direct entry midwives. The concept of going to nursing school first and then becoming a nurse midwife is actually a relatively recent concept in our history of midwifery. And the United States is in the minority when it comes to how other countries practice midwifery. In most other countries, midwives are all educated directly and do not go to nursing school first. For example, direct entry midwives attend the majority of home births in countries such as Canada, the Netherlands, and New Zealand. And in those countries, that is typically how midwives are educated. They are educated directly in midwifery without going through nursing first. I'm going to talk about 3 different types of direct entry midwives in the U.S. We have certified midwives, or CMs, certified professional midwives, or CPMs, and traditional midwives. So let's start with certified midwives. Certified midwives are people who have a background in a science or health-related field other than nursing, who then go on to graduate from a master's level midwifery education program. CMs have similar training and similar scope of practice to CNMs, but they are not required to be a nurse. Similar to CNMs, their certifying agency is the AMCB, and their educational programs are accredited by ACME, just like the CNM educational programs. Similar to CNMs, the majority of CMs attend births in hospitals. CMs have prescriptive authority in just a few states, New York, Rhode Island, and soon to be Maine. They are licensed to practice in those states as well as Delaware and New Jersey. The American College of Nurse Midwives is the professional association for CMs as well, and they are working to increase the number of states that recognize the CM credential. In the states where they can practice, certified midwives are covered by most private insurance companies, but they're covered by Medicaid only in New York, New Jersey, and Rhode Island. And like the CNMs, they're required to go through recertification every 5 years. Next, let's talk about CPMs. So the most common type of direct entry midwife in the U.S. is a certified professional midwife, or CPM. This is the only midwifery credential in the U.S. that requires students to be trained in out-of-hospital settings. Certification does not require an academic degree. Instead, it's based on you demonstrating competency in specific areas of knowledge and skills. CPMs have a different certifying agency. Their certifying agency is the North American Registry of Midwives, or NARM. However, NARM is accredited by the NCCA, just like the AMCB is accredited by the NCCA. The professional association or organization for CPMs is the National Association of Certified Professional Midwives, or NACPM. There are two ways you can become a CPM in the United States. Both of these paths prepare a student to successfully pass the NARM certification exam. All candidates who want to become a CPN must pass that NARM written exam, regardless of which of the two educational pathways they take. The exam has 300 multiple choice questions, each with 4 possible answers. But before a student can sit for the test, all of their knowledge and skills must be first taught and verified through one of those 2 pathways that I mentioned. One pathway is for the student to complete the Portfolio Evaluation Process, or PEP. This is an apprenticeship program that includes verifying your knowledge and skills by registered preceptors. Preceptors can be experienced CPMs. They also may be CNMs, CMs, or physicians. After completing the PEP, the student may also complete the Midwifery Bridge Certificate to meet some state requirements for accredited education. So this adds about 50 hours of accredited education to their educational process. So that's one pathway, and it's primarily an apprenticeship pathway with independent study and clinical experiences. The other option to become a CPM is to complete an educational program that's accredited by the Midwifery Accreditation Council, or MEAC. MEAC. MEAC educational programs are based on the same knowledge and skills that would have been verified through the PEP educational pathway. MEAC is authorized by the U.S. Department of Education to accredit midwifery educational programs and institutions. So MEAC is kind of like the counterpart to ACME, which ACME is used for CNMs and CM programs. MEAC currently accredits 11 schools of midwifery. The programs have a lot of variations. Some finish with a degree, others you finish with a certificate. Some of them are distance learning, some of them you have to live there part of the time, and some of them you have to reside near the school. So we do have some minimum clinical experiences that are determined by NARM. So the students are required to attend a minimum of 55 births, 100 prenatal exams, including 20 initial prenatal exams, 40 newborn exams, and 50 postpartum exams. Their clinical experiences also require continuity of care, which I'll describe in a minute, 2 planned hospital births attended in any role, and at least 5 home births. So out of the 55 births that they're required to attend, 10 can be in the role of observer, 20 must be attended as an assistant under the supervision of a registered preceptor, and 25 must be attended as the primary midwife under supervision. You must have 5 births documented as providing continuity of care as a primary midwife under supervision. This means you would attend 5 prenatals spanning 2 trimesters, the birth, the newborn exam, and 2 postpartum exams of the same client. So continuity of care means you're providing the prenatal care, the labor and birth care, and the postpartum care to the same person. These 5 continuity of care births can occur in any setting, and the entire clinical training experience must span at least 2 years. A recent review of NARM application data show that most training of CPMs spans 3 to 5 years. The PEP requirements for clinical experience are the same as the minimum requirements for MEAC schools, as I just mentioned. However, some MEAC schools require more for their particular degree or certificate program, and some states require more in order to be licensed by the state. For example, Bastyr University, which is in Washington State, requires 60 births and an additional 40 births, so a total of 100 births are required for Washington State midwifery licensure. The CPM scope of practice focuses on pregnancy, birth, and the postpartum period. In their training, they're trained to recognize abnormal or dangerous conditions that require consultation or referral to other professionals. They conduct physical exams, can order and interpret routine tests, administer medications, and use some medical devices as allowed by state law. CPMs mostly practice in homes and freestanding birth centers. However, in some states, CPMs provide well woman and maternity care in clinics and physicians' offices. CPMs are legal to practice in 33 states. That number comes from a website called The Big Push, which is working to help CPMs become legal in more states. Most of those 33 states regulate CPMs through a licensure process. CPMs do not have prescriptive authority. However, some states allow CPMs to obtain and prescribe just a few select medications, and others allow them to administer medications as needed, which is sort of different than prescribing. So, insurance coverage of CPMs varies. There's 6 states that mandate that private insurance covers CPMs, but in others there is no such requirement. And Medicaid covers their services in only 13 states. Once you become a CPM, you have to be recertified every 3 years. So with direct entry midwives, we've talked about CMs, CPMs, and now I'm going to tell you about traditional midwives. So some midwives who attend home births in the United States are not licensed or certified. For religious, personal, or philosophical reasons, they choose to continue the midwifery tradition as it has been in the past. They view it as a personal social contract between the midwife and the client, and they don't want any involvement of certifying, accrediting, or government agencies. Traditional midwives often work or belong to communities with strong religious or cultural ties, and they believe that they are accountable to the communities that they serve. The education of a traditional midwife involves self-study and apprenticeship, with more experienced midwives passing their knowledge on to the less experienced midwives. So in summary, in the United States, midwives can be sorted into nurse midwives and direct entry midwives. Direct entry midwives enter midwifery directly instead of through a nursing program, which is typical throughout the rest of the world. Direct entry midwives, especially certified professional midwives, attend the majority of home births in the United States. And the CPM is the only midwifery credential that includes education and out-of-hospital birth in their educational experience. However, with birth certificates, it's often hard to look at the outcomes of these different types of educational pathways because, as I said at the beginning, there's only basically 2 checkboxes. You can be either checked as a certified nurse midwife / certified midwife, or you can be checked as an other type of midwife, which includes CPMs and traditional midwives. I hope you found this information helpful and that it's good background info for you as we move into the webinar that starts this week. If you haven't registered yet, our first session starts Wednesday, April 25th in the evening Eastern time. So make sure you register at ebbirth.com/homebirthwebinar, where we're going to talk about the safety statistics on home birth in 3 different countries, including the United States. I hope to see you all there. Thanks and bye.